is a privilege to look after people who are at their end of their life. The staff that are able to do this kind of work are very special indeed.
The hope is for a pain-free death, a peaceful death, and finally the hope is that they're remembered with love in the future.
Often people think palliative care is about death. That's eventually going to happen for all of us, but for us as a health professional, it is making sure the life left is a quality of life.
We do accompany a lot of people and their families through their last journey of life, which is their death. It is of paramount importance to the staff that we treat our patients with dignity and respect. So the palliative care provides assistance not just in the hospital environment but in the home as well.
A good outcome in palliative care is a comfortable death, a death without fear, a death certainly without pain, a death where your loved ones can be there. They can travel on that journey, they can take you to the end.
Peacefully, in a way that they think is appropriate and leaves the family with a sense of peace and meaning.
And sometimes we have patients that have pets. Their pets are an important part of their lives. A pet coming in to visit a patient is a magical thing. The change in the patient's face, they relax, they're happy to see them, and the hand, however frail, reaches out to stroke the dog. Human touch. The human being relies so much on touch to feel special, to feel loved. This is what pet therapy is about. It's about making the individual feel loved.
We understand we're treating more than the patient. We understand we're treating the family too.
One important aspect of it is the butterfly tiles that we use. They give the patients a memento to give to their families. That's so, so important. The butterfly is an international symbol of hope in palliative and hospice care. It symbolises regeneration. As the butterfly evolves, so does life. We always say to patients' families, when they're grieving, and they do grieve as we do, that to remember their loved ones and that they're only a butterfly kiss away.
Colonel Bullwinkle is a great name in nursing profession, health profession, Australian history, and now I'm very proud to say a chair in palliative care is named after her.
The Vivian Bullwinkle Chair in Palliative Care Nursing was established by Monash University 10 years ago. Eastern Health has now committed to hosting the Vivian Bullwinkle Chair in Palliative Care Nursing. There is a huge amount of benefit that we can receive from having a chair in palliative care nursing. It absolutely champions that nurses are forefront of palliative care and the excellence of care that they provide. It will also provide training opportunities for nurses, and it will provide academic leadership and research in the area of end-of-life care.
It will make an everyday difference in our lives. Research is so important.
The chair will support researchers to look at the ways we can improve the palliative care offered to people.
To continue to deny that death is an outcome and that we all must push on and pretend we're going to live forever is a fallacy, and it leaves a lot of wounds and unresolved feelings and sometimes a lot of anger, and I'd like to see that addressed.
I have early memories of my mother dying and a palliative nurse going and sitting with her. They gave her time, not the time that they thought she needed, but the time she wanted. That for me is what palliative care is about, giving people the time when they need it the most. I'd like to thank you all for supporting the Vivian Bullwinkle Chair, and I'd encourage you to generously donate to this wonderful cause. It will help us help others in the future and those that we nurse now.
Thank you.